At Blue Water Spa, we get lots of questions about non-surgical treatments, especially injections, and I've noticed that there's some misinformation out there. So I thought it would be great if we could share a few important tips about things we should consider. First, it's important to choose the right injector. Fillers and neurotoxins don't inject themselves, and it's so important to choose a well-trained injector. Our injectors work closely with our plastic surgeon, Dr. Michael Law, who's received 10 years of formal surgical training, including a fellowship that focused on vascularity. Understanding the vascularity of the face is essential for safe injections. Our team of injectors observes and assists Dr. Law in some of his facial surgery and structural fat grafting cases for additional training on facial anatomy. We also send our nursing professionals to multi-day cadaver trainings. This high-level, ongoing training allows them to understand what happens under the skin. A medical professional with this kind of training is essential for the safest, most aesthetically pleasing outcomes. Next, let's talk about how they're going to handle complications. While serious complications with aesthetic injections are rare, they can happen, and some require an all-hands-on-deck approach. Before you get filler, ask about the protocol for handling a vascular occlusion. Does the practice have a team available for daily or even round-the-clock care? Ideally, is there a plastic surgeon who understands the vascularity of the face involved? These are crucial questions to ask. Next, let's talk about cannulas versus needles. Cannulas, which have blunt tips, are often safer than needles because they're designed not to puncture blood vessels. This typically results in a safer procedure with less bruising, swelling, and discomfort. It's worth asking if your injector is skilled in using cannulas. Next, choosing the right filler. There's no one-size-fits-all when it comes to fillers. Different products are better suited for different areas and goals. For example, we use a range of options like PRF Easy Gel, Sculptra, although not in the lips, and hyaluronic acid fillers like Juvederm and Restylane. Our injectors are trained to select the best product for your specific needs. Next, less is more. It's always good to start slow, especially if it's your first time. You can always add more later if needed. While it's possible to dissolve filler, it's not ideal and can be more challenging than what some might think if you want truly natural results. Next, find a practice that matches your aesthetic. When choosing a medical spa, look for a practice whose aesthetic aligns with your own. Check out the staff photos. Do they have obvious or natural-looking filler? When you visit, take note of how the team looks. Some places prefer a more done look, while others focus on natural results. Next, filler before a facelift. This has been a hot topic lately, and it's important to ask your plastic surgeon for their opinion. At Blue Water Plastic Surgery, we recommend being free of filler for at least 6 months before a facelift. Make sure to be open about all of your past treatments, as some procedures like PDO threads or radiofrequency might require special consideration. Lastly, we are so happy to see the trend shifting towards a more natural look with less filler. In the right hands and with the right product, filler can look and feel very natural. While there's some talk about the decline in interest for neurotoxins, we're still seeing people enjoy the benefits of products like Botox, Dysport, and Daxxify, just with a preference for more natural looking results.